I go to work every day knowing that money alone is not enough to help Masanda. Masanda lives in a remote village in Uganda, and it's time for her daughter's vaccinations. Now, when that time came for my children, we hopped in the car and drove down to the pediatrician. But you see, it's not that simple for Masanda. For her, the clinic is a 10-kilometer hike over a hot and treacherous footpath. The trip takes several hours each way. And unfortunately, when she gets there, there's a good chance she could be turned away. There are many reasons that she could be turned away. The first is poor infrastructure. Bad roads or no roads make that last mile delivery of vaccines very difficult. It could be that inadequate data systems have failed to properly forecast demand, and the clinic has simply run out of vaccines. It could be that the refrigerators that are needed to keep the vaccines at the right temperature are broken, or the power was out earlier in the day, allowing the vaccines to get too warm to be useful. Or it could be that there's only one trained staff person, and that person's away today and had to close the clinic. Regardless of the reason, her journey may be in vain. You know, I first heard Masanda's story and many families like her when Gavi, the Vaccine Alliance, approached my employer for support. Now, corporate donations typically take one of two forms. A company will either write a check or they'll donate their goods and services. Well, my company did something different. They chose a new path. They did something that I think is revolutionary in the world of global corporate philanthropy. They donated me. I was my company's donation. For those of you that don't know Gavi, Gavi is an international vaccine alliance. Since 2000, working in 73 countries, they have vaccinated more than 500 million children. Their mission is to increase access to immunization in our world's poorest countries. And you know, by 2020, they have a goal that just over 50% of the world's children will be fully vaccinated. Now, to accomplish this, they intend to immunize 300 million more children. Now, to put that in perspective, that means 90 million moms, just like Masanda, will need to make that ever-important trip to the clinic. And it's critical that when these moms get to the clinic, that there are vaccines that are available. Because if their children do not get fully vaccinated, the World Health Organization estimates that 100 million of them will still get sick, and 5 to 6 million could die. And we can't stand for that. So, to reach the 50% goal, Gavi has a supply chain initiative that they will roll out over the next 5 years. And my company, one of the world's largest logistics companies, just happens to have the expertise that they need. So, a year ago, I went to Geneva as a secondee. I didn't know what a secondee was until I became one. Turns out, a secondee is a loaned executive. Gavi was, in effect, borrowing my experience and my talent, while my company continued to pay my salary and cover my expenses. I've been there about a year, and I will be there probably until the end of this year. And that's what makes this so different. And that's what makes this so special. I am a targeted donation from the private sector. It's funny, sometimes the people that I work with are skeptical about what somebody from the private sector can bring to the table. Sometimes I wonder the same thing. I often ask, what am I doing here? But I figured it out. I discovered that I'm there to take 30 years of experience in moving product all around the world to now get vaccines to children who otherwise would not get them. And in the process, keeping them healthy and in many cases, keeping them alive. It doesn't get much better than that. So what do? I've developed training programs for supply chain managers. We use mobile phones and apps to better track and trace product usage and record data. We develop maintenance programs for these refrigerators, and we look for alternative sources of power. For that last mile delivery, we're examining alternative delivery methods such as unmanned aerial vehicles. We know them as drones. But you know the best part? We have spent the better part of the last year developing the solutions and putting together the plans. But now we're going to implement those plans. So now is when the fun begins. Because now is when we really begin to make a difference. And now is when we help Masanda the most. I count myself proud and I count myself fortunate that I work for a company that values skills and experience as much as money and services. I call what I'm doing talent sharing, and I measure its value as the years of employee experience and their passions. You know, in 2013, the global private sector donated $69 billion in cash and goods and services. So I do want to be clear that I am not advocating any less of this type of donation. That much and more is still needed. Rather, I'm suggesting that there's another resource that corporations can bring to the table. And that resource is our people and their talent, experience, and passion. My view of the world has changed. And my view of my role in the world has crystallized. I'm more patient now, and I listen better. When you're in countries where your first language is everybody else's second or third, you have to be patient, and you have to listen just to follow the conversations. But I believe I'm also more compassionate. And if nothing else, this experience has verified, has confirmed a long-held belief of mine that in spite of everything that we see on the news every day, compassion is a universal human trait. But you don't have to go to Geneva to match your passions with your experience. Anybody can be a corporate donation. It can be as simple as an accounting firm donating 3 or 4 hours a month to help a local nonprofit balance their books. It's estimated that there are roughly 10 million nonprofits in the world. So look around. I get chills when I think of the experience and the passion that's here in this room now, today. Think of the difference that we can make in our world, in our communities, if our companies donate just a handful of us, or if we donate ourselves. You know, Masanda made the trip. The clinic had the vaccines that her daughter needed. Her journey was not in vain. And you know what? Over the next 5 years, millions of more moms will make that same journey. And their journey won't have been in vain either. In part because I was my company's donation. Thank you. Thank you.